So the transverse abdominis, its real major job in life is to perform that drawing effect. So if you're trying to stand up like a tough guy, then that's going to pull the musculature in. And then what was shown back in the 90s, the effectiveness of that transverse abdominis in co-contracting and stimulating the multifidi of the posterior muscles, which we'll look at here in a second. So this is just a lateral view showing the attachment from the thoracic rib cage of the external oblique to um, the linea alba, the fascia to the anterior, as well as the ilium and the iliac crest. So you could see why when those two components, when those two attachments approximate, we get rotation to the opposite side, and you can see the attachment of the internal oblique, so that orientation of those fibers are actually going to be the opposite, and hence the reason why we see rotation to the same side with the internal obliques. Then we're looking at extension in the cervical region, splenius capitis, cervicis, and then we'll see some of these oblique muscles to the posterior that are going to provide some extension moment. So as you can see, the splenius capitis attaching to the base of the skull at the mastoid process, and so again, we typically don't separate out head extension from cervical spine extension, but obviously, as you can see, it is possible and usually done from um, a manual muscle facilitation technique if we wanted to really try and separate those out. And then most of what we think in terms of extension of the rest of the spine and thoracic and the lumbar region are the erector spinae. So the spinalis longissimus and iliocostalis. And that's actually going from lateral into the midline. And then some of these smaller muscles, the semispinalis and then the deep spinal muscles, we'll see that the size of these erector spinae are much larger than the smaller intrinsic muscles that we see, and they're named for where they're attached to. And just wanted to note that when we look at these smaller intrinsic muscles, their attachments are very, very close to the axes of rotation. They're very, very short. Cross-sectional area is very, very small. So they're synergists. You know, if we lost our erector spinae, it'd be very difficult to perform very forceful and rapid motions in extension. But they're highly innervated. So those are the ones that help to give us the motor control of the individual segments, you know, because it takes so many segments to actually get, you know, the complete motion. Lateral flexion is going to take place in the frontal plane, and again, we're going to see a lot of similarities in the musculature in the cervical, as well as in the rest of the region. In the lower component, so that quadratus lumborum, very, very important muscle because it, as we'll talk about with gait, it helps to support the pelvis during gait. But when the pelvis is locked, so we can use the quadratus lumborum, it's very much in that frontal plane, so attaching to the posterior aspect of the iliac crest and the lower ribs. So very, very important in maintaining pelvic stabilization during gait. And then we also have the psoas major muscle. The psoas major is a slightly more anterior muscle, and that's obviously a power hip flexor, but it's going to provide us a lot of lateral flexion, usually support to lateral flexion as well. We look at loads on the spine, so typically body weight is going to be the biggest one, a lot of tension through the spinal ligaments, but most of these forces are going to be generated through the spinal musculature, and that's why we're capable of generating such large forces or picking heavy things up and that sort of thing. And then of course any external types of loads that we're going to have by, you know, holding things, throwing things, pushing things, and so on. So we look at the loads of the spine. Again, just the weight of the torso is going to provide compressive forces, and then of course maintaining any sort of stabilization, those compressive forces are also going to be generated by the musculature, and it kind of makes sense. It's sort of the telephone pole wire effect where, you know, to maintain normal posture position, we're going to have muscle contraction providing loading really in all different planes to provide that stability. And then of course anytime there's going to be motion, we're going to see some changes and potential increases. So this is just looking at the directed forces, because remember your spine is not just one simple rod, that it has a curvature motion to it, and so we can see that yes, the body weight is directly downward, but because of the orientation of the components, the motion segments, we see that those forces are going to be generated in both compression as well as shear force. So the compressive forces are going directly down, perpendicular, or in the longitudinal axis, and then the shear forces are actually going to go perpendicular to that. So as you can imagine, as we start to lean forward, we'll see an increased amount of shear force. And again, those forces can become very, very high, especially if you think about some of the exercises or leaning over and picking things up. So it's very important that we get proper support through the musculature that are really going to provide those supportive types of tension. Remember the other component, the intervertebral disc, that when we're looking at relative different positions, that we see either increase in compressive forces or increase in tension forces. So this is showing an extension moment or a hyperextension, where we start to see an increase in compressive forces to the posterior aspect of the intervertebral disc, and then we see an increase in the anterior tension of those, and it would essentially be the opposite, going into flexion position. And as you can see, back here, that's the point at which we exit the spinal nerve root. So we start to see some closing down of those forces. Also along here, you could see where these facet joints that we talked about earlier as synovial joints in the lumbar spine. Remember that they're in that sagittal plane. So that's why we have a whole lot more compressive forces, specifically in the extension moment. So those facet joints, and that's why they take up a lot of those compressive forces. The other benefit of having these intervertebral discs is it helps to disperse some of those loads throughout. And as you can imagine, when we don't take care of things properly, we get excessive loading and excessive stresses into directions that it's not really designed to withstand. We start to get breakdown of some of the tissues. It's not like other joints, unlike other joints in other components to the body. It's just that we happen to have this intervertebral disc in there. Very, very important, but again, it can shut down and deteriorate just like all the others.